The emergency room is a place where lives are saved. Where every name is written down. And every patient is recorded. But what if I told you that some patients check in? Their names appear on the screen. Their forms are printed. Their wristbands are ready. But they are never admitted. No room. No doctor. No record. And sometimes, no body. Tonight, you will hear 9 true emergency room horror stories that doctors and nurses were never supposed to talk about. Stories where the hospital remembers someone who officially never existed. Before we continue, make sure you're already subscribed to the channel. Tap the like button if you enjoy dark, real horror stories. And tell us in the comments where you're watching from. We love knowing how far these stories travel. Especially when the lights go out. Now, let me tell you about the first patient. The patient who was never admitted. My name is Daniel Brooks. I work in emergency room. Small hospital. Old building. Walls very white. Lights very bright. But at night, hospital feel different. At night, emergency room is quiet. Too quiet. Sound of machine, beep, beep. Footsteps echo long. Air feel cold even in summer. This story happened 3 years ago. I was night duty nurse. Time was 2:14 a.m. At this time, no people come usually. Only drunk people. Accident people. Or very sick people. I was sitting on desk. Drinking bad coffee. Watching computer screen. Then. Automatic door open. A man come inside. He walks slow. Very slow. Like he is tired of walking whole life. He look around. Then look at me. He was around 35 or 36 years old. White skin. Wet hair. Clothes also little wet. Like he was standing in rain before coming. His eyes. His eyes not normal. They look scared. But also empty. Like he already knows something bad. He come near desk and say very low voice. I not feel okay. I ask him, what problem? He touch his chest. Not pain face. Just confused face. I feel, wrong. Inside. I ask his name. He say. Michael Carter. I ask date of birth. He tell me. Normal date. I type his name in computer. System accepted. That was first strange thing. Our hospital system always show error for new patient. Always ask ID. Always slow. But his name go inside fast. No warning. No red sign. I print wristband. Printer makes sound. I take wristband in my hand. I look up. The man is gone. Chair empty. Floor empty. Door closed. No sound. No footsteps. Nothing. I stand up fast. Sir. I say loud. No answer. I check bathroom. Empty. I check hallway. Empty. Security desk close by. I ask guard. Did someone just come in? He say. No. No one enter. I feel strange feeling in stomach. I go back to computer. His name still there. Michael Carter, waiting for admission. I try to cancel entry. Mouse freeze. Keyboard not work. Screen blink one time. Then message show. Patient already checked in. I feel cold on my neck. I call IT support. They say system fine. I call charge nurse Sarah. She come and look screen. She laugh little. Maybe system bug, she say. But I see her face change. Because she try also delete name. She cannot. Then Sarah say something I never forget. Daniel. I don't see anyone in waiting area. But system say patient is here. After that, things get worse. At 2:46 a.m., ambulance come fast. Sirens loud. Paramedics run inside. They bring a man on stretcher. Wet clothes. Blue lips. Cold skin. They say. Found in river. Almost drowned. I look at patient face. My heart stop for 1 second. It is same man. Same face. Same hair. Same clothes. Michael Carter. I check chart. Name already in system. But admission status say. Not admitted. Doctor try save him. CPR. Shock. Medicine. Nothing work. Time of death call at 2:53 a.m. Room become quiet. Doctor leave. I stand there. Looking at body. I remember something. Wristband. I look at his arm. He already wearing wristband. Same wristband I printed earlier. Sarah whisper. But, we never put this on him. We check camera again. Footage show ambulance coming. Paramedics running. But before that. No man enter hospital. No Michael. But system show he come first. Like he come before his own body. Police come later. They ask questions. I don't tell everything. Because who will believe? Next morning, IT reset system. But his name's still there. Not active. Not deleted. Just, there. 1 month later, I ask doctor about Michael. Doctor say something strange. He was declared dead. But legally. He was never admitted. Means on paper. Michael Carter never existed in hospital. But I still remember his eyes. Scared. Empty. Like he already know. He will die that night. This is only first story. Emergency rooms see many things. Some patients come too early. Some come too late. And some come before they die. The woman who had no reflection. My name is Emily Watson. I work as front desk clerk in emergency room. Not nurse. Not doctor. Just front desk. My job simple. Take names. Ask problem. Give papers. But that night. Job was not simple. Time was 3:30 a.m. Winter night. Outside snow falling slow. Inside hospital, lights bright. Floor shiny. Glass everywhere. Emergency room very quiet. Too quiet. I was alone on desk. Security guard sleeping little far. Doctors busy in back rooms. Then I hear sound. Tap, tap, tap. Like shoe heel on floor. I look up. A woman standing near glass door. She not enter yet. Just standing. I wave hand. She push door and come inside. She walk normal. Not slow. Not fast. She look around like first time. She wear long black coat. Hair dark and wet. Like snow melting. She come to desk. Her face very pale. White like paper. But her eyes. Eyes very alive. She smile little and say. I need help. Her voice soft. Too soft. I ask, what happened? She say. I feel very cold inside. I think maybe fever. I ask her name. She say. Laura Mitchell. I type name. I ask date of birth. She tell me. Everything normal. But then. Something feel wrong. Behind me is big glass wall. Glass reflect everything. I always see myself in it. I see desk. I see chair. I see lights. But. I do not see her reflection. I blink my eyes. I look again. Nothing. Where she stand? Glass empty. I move head left. Right. Still no reflection. I feel heart beat fast. I look at her face. She's smiling. Like she know I see something wrong. I ask, are you okay? She nod. Yes. Just cold. I print paper. My hands shaking. I give her pen. She take pen. Her hand touch mine. Her hand very cold. Not winter cold. More like freezer cold. I pull hand back fast. She notice. She say. Sorry. I tell her, please sit. She go sit on chair. I watch glass. Chair show reflection. But she not. Only empty chair. I feel panic. I call nurse Karen quietly. I point at woman. Karen look. She whisper. Why you look scared? I say. Do you see her? Karen say. Yes. Patient. I say. Look glass. Karen look glass. Her face change. She go closer. She wave hand behind woman. No reflection. Karen swallow hard. This not normal, she say. We decide bring doctor. Dr. Henry come. He ask woman question. Woman answer calm. She say chest feel cold. Breath feel heavy. Doctor ask check pulse. He touch wrist. He stop. He touch again. He frown. He say nothing. Doctor ask nurse take vitals. Machine show error. Try again. Error. Doctor ask woman to stand. She stand easy. Doctor ask walk. She walk fine. Then doctor say. We take you inside. Woman smile. Okay. She stand and follow nurse. As she walk past glass wall. For 1 second. I see something. Not reflection. But shadow. Shadow move wrong direction. Like delay. I feel dizzy. Minutes later, nurse run back. Face white. She gone, nurse say. Doctor shout, what you mean gone? Room empty. No woman. No coat. No footprints. I check system. Her name still there. Laura Mitchell, waiting. Security check camera. Camera show woman entering. Camera show her talking. Camera show her sitting. Then. Camera glitch. Screen static. Then chair empty. Like she disappear. No exit. No door. Police come. They ask details. Later that morning, detective tell us something. They found car in snow. Crash near bridge. Woman died 2 hours before she come hospital. Name, Laura Mitchell. Cause, hypothermia. Doctor say. She was already dead. But system still show. Not admitted. Next week, I quit job. I cannot sit near glass anymore. Because sometimes. When I walk past glass. I see someone standing behind me. No reflection. Just watching. Emergency room not just place for living. Sometimes. The dead also come. The child who was never on the list. My name is Daniel Moore. I work as junior nurse in emergency room. I not very senior. I still learning job. That night was my third night shift. I was nervous already. Emergency room smell like medicine. Lights white and strong. Sound of machines everywhere. Time was 1:40 a.m. Rain outside. Heavy rain. Doors open. A woman run inside. She screaming. She crying loud. She holding a small child in arms. Child look like 6 or 7 years old. Boy not moving. Woman shout. Please help my son. Everyone look. Doctor run. We take child fast. Put him on bed. Woman shaking. She say. He stop breathing in car. Doctor check pulse. Nothing. Doctor say. Start CPR. We start CPR. I look at child face. He look peaceful. Too peaceful. Skin pale. Lips blue. I ask woman child name. She crying. Ethan. His name Ethan. I ask last name. She say. Ethan Parker. I go to computer. I type name. System loading. Then message pop. Error, patient not found. I try again. Same error. I think system problem. I try make new entry. System freeze. Doctor shout. Daniel, chart ready. I say. System not working. Doctor angry. Use paper. I write name on paper. Doctor working on child. Minutes pass. No response. Doctor stop CPR. He look at time. He shake head. Doctor say soft. I'm sorry. Woman scream. She fall on floor. Crying. Security come. Doctor tell me. Take mother to quiet room. I help her stand. She feel very light. Like no weight. Her hands cold. Very cold. She look at me and say. He was never sick before. I nod. She say. He hate hospitals. I take her to room. I leave her with counselor. I go back to ER. I need update chart. I go computer again. I search Ethan Parker. Nothing. No record. No paper. Even paper I wrote on. Missing. I feel strange. I go ask doctor. Doctor say. What child? I say. The boy. Ethan. Doctor look confused. There was no child, he say. I laugh nervous. Doctor, I was there. Doctor shake head. We had no pediatric code tonight. I feel cold in chest. I go check room where child was. Empty. Bed clean. No blood. No equipment. Like no one was there. I go find woman. Counseling room empty. Chair empty. No crying. No woman. Security say. No woman leave hospital. Camera check. Camera show door open. Show woman run in. Show child in arms. Show doctors run. Then. Camera cut. Black screen for 12 minutes. Then camera back. Room empty. No people. Police come again. They ask names. I say Ethan Parker. Police search. Later officer come to me. He look serious. He say. There is record of a boy named Ethan Parker. My heart jump. He continue. He died 5 years ago. I stop breathing. Officer say. Car accident. Same road. Same rain. Mother died same night. Names match. Dates match. Officer say. There is no living family. That night, I cannot sleep. Next night, I come work again. At 1:40 a.m., same time. I hear sound. Footsteps. I look. A small boy standing near desk. Alone. Wet hair. Blue lips. He look at me. He smile. He say. Can you help my mom? I freeze. I blink. He gone. Computer turn on by itself. Screen show. Ethan Parker, checked in. Status. Not admitted. I quit job 1 week later. Emergency room still open. But I believe something. Some patients come late. Some patients come wrong. And some never leave. The man who kept bleeding. But had no wounds. My name is Rachel Adams. I work as ER receptionist. I sit on front desk. I check patients. I give wristbands. I see many bad things. Blood. Crying. Death. But this night was different. Very different. Time was 2:17 a.m. Hospital quiet. Too quiet. Lights flicker little. Rain again outside. Door open slowly. A man walk inside. He walking normal. Not running. Not screaming. He wear business suit. Black coat. White shirt. Tie loose. But his clothes are wet. Like rain, but heavier. Water drip on floor. I say. Sir, are you okay? He look at me. His face pale. Eyes very tired. He say slow. I am bleeding. I look at him. I see no blood. Suit clean. Hands clean. Face clean. I say. I don't see blood. He nod. Yes, he say. It is inside. That sentence make my skin cold. I ask name. He say. Michael Grant. Age? 39. I type in system. Name appear. But status strange. It say. Checked in 4 times today. I confused. I look at him. He's standing calm. I ask. Sir, did you come here before today? He smile small. I think so, he say. I don't remember leaving. I feel uneasy. I give him wristband. Band slip from his hand. Fall on floor. I pick it up. Band is wet. But not water. It red. Blood red. I look at my fingers. Clean. No blood. I blink. Band now dry. White again. I feel dizzy. I call nurse. Nurse name Kevin. Kevin come. He check man. He say. No visible wounds. Man say again. I am bleeding. Kevin say. Where? Man touch chest. My heart, he say. We take him to bed. Doctor come. Doctor check vitals. Heartbeat normal. Blood pressure normal. Everything normal. Doctor say. You are okay. Man shake head. No, he say. I am dying again. Doctor laugh little. Not nice laugh. Doctor busy. He walk away. Man look at me. He whisper. They never listen. Suddenly monitor beep. Heart rate drop. Kevin shout. Doctor run back. They work on him. 4. Oxygen. Machines. I stand corner. I feel cold air. Man open eyes. He look straight at me. He say loud. Not again. Heart flatline. Doctor shout time. They stop. Doctor say. Time of death, 2:41 a.m. They cover body. I feel sad. Even strange, I feel sad. Doctor say. Send body to morgue. Orderly come. They lift body. As they lift. Blood drip on floor. Real blood. Dark. Thick. Everyone freeze. Kevin say. He had no wounds. They pull sheet. Man chest full of old scars. Hundreds. Stitches. Burn marks. Knife marks. Like someone cut him many times. Doctor step back. He whisper. This is not possible. They take body away. Cleaner come. Clean blood. I go back desk. I feel shaking. Computer screen on. I see patient list. Michael Grant name still there. Status update itself. Discharged, 2:41 a.m. Then screen blink. New line appear. Same name. Same age. Same time. Checked in, 2:42 a.m. I look up. Door open again. Same man walk in. Same suit. Same wet clothes. Same tired eyes. He look at me. He smiles sad. He say. Hello again. I scream. Security come. Man gone. Air cold. Lights flicker. Later police come. They ask questions. I tell everything. Officer search records. Officer face turn white. He say. Michael Grant died 3 years ago. I sit down. Officer say. He had rare condition. He bleed inside. No wounds. He came ER many times. He always died. But records say, he always checked in again. That night I cannot forget. Next week, new receptionist start. I train her. I warn her. If a man say he bleeding but you see nothing. She laugh. One night later, she quit. She say. He came back. I don't work nights anymore. But sometimes. When rain heavy. I hear footsteps. And I hear a calm voice say. I am bleeding. The woman who was waiting for a room that did not exist. My name is Daniel Brooks. I work as ER night nurse. I work night shift for 5 years. I see many strange things. But this story still follow me. This happened in winter. Cold night. Snow outside. Time around 3:05 a.m. Emergency room half empty. Only few patients. Old man sleeping. Child crying soft. Then automatic door open. A woman walk inside. She wear long gray coat. Hair wet with snow. Face very calm. Too calm. She walk slow. Not hurt. Not scared. She stop in middle. She look around. Then she smile. She say. I am here for my room. Receptionist ask name. Woman say. Emily Carter. Receptionist type. Nothing come. Receptionist say. I don't see your name. Woman nod. Yes, she say. That always happen. I feel strange. I ask. What problem you have? She say. I am waiting. Waiting? For what? I ask. She point hallway. For the room, she say. There is a room for me. I ask. Which room? She say slow. Room 913. I freeze. Hospital rooms end at 912. There is no room 913. Never was. Receptionist laugh little. She say. Ma'am, that room not exist. Woman smile bigger. Yes, she say. I know. Then why you here, receptionist ask. Woman look at me. She say. They told me to come back. Who? I ask. She whisper. The voices from the walls. My stomach drop. I ask doctor. Doctor say. She may be confused. Give her bed. Doctor tell me take her to waiting room. I walk with her. Her steps make no sound. Not shoes sound. Nothing. Hallway lights flicker. She look at doors. She touch walls. She whisper something. I ask. Are you okay? She nod. They are waking up, she say. I stop. Who? The ones who never left, she say. We reach waiting room. I sit her on chair. She sit straight. Hands on lap. Very polite. I ask questions. Age? 27. Pain? No. Injury? No. Why? She say. Because this is where it started. I ask what started. She look down. She say slow. I died here. My heart beat fast. I laugh nervous. That not funny, I say. She look at me. Her eyes wet. I am not joking, she say. She tell story. 3 years ago. She come ER with chest pain. Busy night. No beds. Doctors delay. She wait. And wait. She feel cold. She hear voices. They tell her. Room 913 is ready. She stand. She walk hallway. Past last room. She see door. Door with number 913. She open. Inside is dark. Cold. Smell like old metal. She step inside. Door close. She feel pain. Then nothing. I stop her. This hospital never had room 913, I say. She nod. I know now, she say. But then, I didn't. Suddenly lights go out. Only emergency red lights. Room cold. She stand. She walk to hallway. She say. They are calling me again. I grab radio. No signal. I feel fear. She walk fast now. Toward end of hallway. Toward old storage area. Area closed. Locked. She stop at wall. Blank wall. No door. She touch wall. She smile. This is it, she say. I shout. There is nothing there. She knock wall. 3 times. Wall knock back. 3 knocks. My blood freeze. Wall open. Not like door. More like shadow open. Dark inside. Cold wind. I smell rust. And blood. She turn to me. She say soft. Tell them I waited. She step inside. Shadow close. Wall normal again. Lights come back. I scream. Security come. Doctors come. We search. Nothing. No woman. No door. Just wall. Cameras checked. Footage show her walk in. Sit. Stand. Then disappear. No shadow. Just vanish. Administrator angry. Say stress make illusion. I almost believe. Until next week. Another woman come. Same coat. Same calm face. Different name. She say. I am here for room 913. We lock doors that night. But people still say. Sometimes at night. Wall near storage feel warm. Sometimes cold. Sometimes nurses hear knocking. 3 times. And sometimes. A voice say. I am waiting. The patient who answered his own death call. My name is Michael Turner. I work as emergency room dispatcher. My job simple. Answer phone. Send ambulance. Talk calm. But this night break my mind. Time was 2:17 a.m. Rain outside. ER quiet. Phone silent. Then phone ring. I pick. Emergency services, I say. Line silent. Only breathing. Slow breathing. I say again. Hello. What is your emergency? A man speak. Voice weak. He say. I think. I am dying. I ask name. He say. Robert Hill. I ask location. He say hospital name. Same hospital. Same ER. I feel confused. You are already here. I ask. He say. Yes, but no one see me. I check system. No Robert Hill. I say. Sir, where exactly you are? He whisper. Near the phones. My chair shake. Phones are with me. I look around. No one there. I say. Sir, I am at phones. I don't see you. He breathe hard. He say. I am on the floor. I stand fast. Look down. Nothing. Only tiles. Cold tiles. I ask. What happened to you? He say slow. Heart pain. I came by myself. I ask time. He say. Maybe 1 hour ago. Or more. I tell him stay calm. I tell nurse. Nurse search waiting area. Nothing. Phone still connected. He suddenly scream. Not loud. Pain scream. He say. It hurts again. I ask him to describe. He say. Cold. Very cold. I say. Help is coming. He laugh. Small laugh. He say. They already came. Line crack. I hear machine sounds. Beep, beep. Like heart monitor. Then flat sound. Beep. I shout his name. No answer. Line dead. I sit frozen. My hands shaking. I tell supervisor. He angry. Say prank call. I try forget. 30 minutes later. Phone ring again. Same line. I pick. Same voice. But calmer. He say. Hello Michael. I never say my name. My blood cold. How you know my name? I ask. He say. You answered my first call. I say. Robert, are you okay? He pause. He say. No. I ask where he is. He say. Hallway near trauma room. I go there with guard. Phone still on. I hear his breathing. We walk hallway. Lights flicker. He guide me. Left, now right, stop. We stop near trauma room 3. Door closed. Red light on. Busy inside. I hear doctor voice. I hear machine beep. Robert say. I am inside. I look through window. My legs weak. On bed. A man. Same face from ID photo. Name tag, Robert Hill. Doctors doing CPR. Chest compress. Shock. Shock again. Doctor shout time. Nurse cry. Robert on phone say. That is me. I drop phone. Guard pick. Robert still talking. He say. They trying to save me. Doctor shout. Time of death. 2:19 a.m. Silence. Machine flat. I feel sick. Phone line still open. Robert breathe stop. Then he speak. Voice different. Echo. He say. They stopped. Guard drop phone. Phone crack. I pick again. I say. Robert. He say. I am standing now. Lights flicker strong. I feel cold wind. I smell metal. Blood smell. I say. Please, where are you? He say. Behind you. I turn. Nothing. But glass reflection show shadow. Human shape. No face. Just dark. He say. I don't know where to go. I close eyes. I pray. I say. Robert, you must move on. He quiet. Then he say. Will you stay with me? My throat tight. I say nothing. He whisper. Okay. I understand. Phone goes silent. Next day. Supervisor fire me. Say mental issue. Say stress. I go home. Weeks pass. One night. My phone ring at home. Unknown number. I answer. Silence. Then breathing. I hang up. Phone ring again. Same. Third time. I answer. Voice say. Michael. I cry. He say. I am still here. I throw phone. Phone break. But sometimes. At night. I hear phone ringing. Even when phone dead. And sometimes. I hear voice say. Emergency services, please help. The woman who waited even after her name was called. My name is Emily Carter. I work as nurse in emergency room. I work night shift. Night shift very quiet. But also very scary. This story happened 3 years ago. One night. Time around 3:40 a.m. Rain outside. Hospital lights dim. Waiting room almost empty. Only one woman sitting. She sit on last chair. Near wall. She wear long gray coat. Hair cover face. She not move. I call names. Jason Miller. No answer. Anna Brooks. No answer. Only that woman sit. I look at her. She not look back. I ask receptionist. Who is that woman? Receptionist check computer. She say. No one left. I say. But there is woman. She look. Her face change. She say. I don't see anyone. I turn. Woman still there. I feel cold. I walk close. I say soft. Ma'am. Are you okay? She raise head slowly. Her face pale. Eyes dark. Very tired eyes. She say. I am waiting. I ask name. She say. Laura Bennett. I check list. No Laura Bennett. I ask. When you come? She say. Long time. I say. Do you have pain? She touch chest. She nod yes. I say. Please follow me. I take vitals. She stand. Her steps very slow. Like heavy legs. We walk hallway. Her shadow long. But light behind her broken. Shadow move wrong. I feel scared. Inside room. I ask her sit. I take BP. Machine show error. Again error. Her skin very cold. Too cold. I touch her wrist. I feel no pulse. My heart race. I check again. Nothing. But she talk. She look at me. She say. Am I okay? I don't know what say. I say. I will get doctor. I go out. I tell doctor. Doctor come fast. Room empty. No Laura. Bed empty. Door closed. I feel crazy. Doctor angry. Say. Emily, no joke. I swear. I go back waiting room. Woman still there. Same chair. Same position. She look at me. She smile small. I feel tears. I say. You were in room. She say. I never move. I feel headache. I call her name. Laura Bennett. She stand again. She follow me again. Same room. Same tests. Same cold skin. Same no pulse. Doctor come with me. Doctor see her now. Doctor freeze. He whisper. She has no heartbeat. Laura look at doctor. She say. Then why I still here? Doctor shake. He say. We need crash cart. He run. Laura look at me. She ask. Will I be fine? I want lie. But words stuck. I say. We try. Doctor return. But Laura gone. Again. Doctor scream. He say. This impossible. Alarm ring somewhere. Code blue. Trauma room. I hear name on speaker. Laura Bennett. My blood stop. We run trauma room. On bed. Same woman. Same face. Doctors working. Blood. CPR. Shock. Shock again. Doctor shout time. Time of death. I feel sick. I run out. Waiting room empty. Chair empty. No woman. I cry. Next nights. I see her again. Sometimes sitting. Sometimes standing near door. Every time name called. Every time she wait. One night. I hear whisper. Emily. I turn. Laura stand close. Her face calm. She say. They keep calling my name. I cry. I say. You are dead. She nod. She say. Then why they don't let me go? I don't know answer. Next week. I check old files. I search Laura Bennett. I find record. She died 10 years ago. Same ER. Same waiting room. She wait 6 hours. She die before scene. Heart attack. She was never admitted. Never room. Never bed. Only waiting. After that night. I never see her again. But sometimes. When waiting room quiet. When chair empty. I hear soft voice. Is my turn now? And every time. My heart breaks. The man with no face on the hospital camera. My name is Daniel Moore. I work as security guard. Emergency room. Night duty. I watch cameras. Many screens. Hallways. Doors. Waiting room. Most time boring. But one night. This night change everything. Time around 2:15 a.m. Hospital quiet. Rain sound outside. I drink coffee. I watch screen number 4. Waiting room. I see a man. He sit alone. Near entrance door. I feel strange. Because I never see him walk in. Camera at door show nothing. But now he sit there. I zoom camera. Man wear black jacket. Hands on knees. Head down. Face not clear. I radio nurse. I say. There is man in waiting room. Nurse say. No patient right now. I say. Please check. She go. I watch screen. She walk in. She look around. No man. I feel cold. I zoom out. Camera flicker. Static. Then man appear again. Same seat. Same pose. Like he never move. I stand. I go waiting room myself. Long hallway. Lights flicker. I reach waiting room. Empty. No man. No sound. Only chairs. I feel stupid. I go back to room. I sit. I look screen. Man still there. Now he lift head. My heart stop. His face. Blur. Like camera glitch. I zoom more. No eyes. No nose. Just smooth skin. Like mask. I feel sick. I radio supervisor. No answer. Radio static. Man stand up. On camera. He walk toward hallway. I run. I chase. But hallway empty. Camera show him walking. Real hallway empty. I feel like two worlds. Camera world. Real world. I go back. On screen. Man now at triage desk. Standing. Waiting. I hear nurse scream. From triage. I run. Nurse shaking. She say. There was man. I say. Describe. She say. No face. My stomach drop. She say. He ask for help. She say. He say his chest hurt. She say. He say he check in long time ago. I check system. No name. No record. I go camera. Man sit again. Now closer to camera. I see jacket wet. Like rain. He look straight at camera. I feel like he see me. Screen crack. Static loud. Text appear. On screen. White letters. Why no one see me? I scream. I unplug monitor. Room dark. Emergency lights on. I hear footsteps. Slow. Heavy. I hide. I hear breathing. Close. Very close. Then silence. Lights return. I run. Waiting room. Man sit again. This time nurse with him. Nurse talk normal. Like nothing wrong. She smile. She take clipboard. I shout. No. She jump. Man gone. Clipboard drop. Nurse cry. She say. I saw him. I ask what he say. She say. He say he die here. She say. He wait hours. She say. He never admitted. We search records. Old files. 10 years ago. Man named Robert Hayes. Died in waiting room. Stroke. Camera footage missing that day. One photo left. Security still image. Blurry face. Same jacket. Same seat. After that night. Cameras sometimes show him. Always waiting. Always same seat. But now. He closer. Closer to door. Closer to exit. Last week. Camera show him standing. By door. Looking outside. Rain. I see smile. No face. But I feel smile. Next frame. Camera empty. Door open. Rain inside. I don't know if he leave. Or now. He not need camera. And sometimes. When I sit alone. I feel someone stand behind me. Breathing. Waiting. The child who was discharged. But never left. My name is Emily Carter. I work as ER nurse. I work night shift. I see many bad things. Blood. Pain. Death. But this story stay in my head. Every night. This happened 3 years ago. Cold night. Winter. Emergency room busy. People crying. People shouting. Around 11:40 p.m., ambulance come. They bring a small boy. Age maybe 7 years. Name Oliver. He very thin. Very pale. He not cry. He not talk. Just look around. Eyes big. Too big. Doctor check him. No blood. No broken bone. Heartbeat slow. Very slow. Doctor say. He faint. Maybe cold. We put blanket. I talk to him. I say. Your name. He whisper. Oliver. I say. Where is your parents? He look at door. He say. They leave. I feel sad. Doctor say. We keep him little time. We do basic tests. All normal. Too normal. Doctor confuse. Around 1:10 a.m. doctor say. He okay. Discharge. I feel wrong. I say. He look scared. Doctor say. Call social services. We try. No answer. Phone ring. Ring. No one pick. Doctor sign discharge paper. I sit with Oliver. I give him juice. He not drink. I ask. You want go home? He shake head. He say. I don't have home. My heart break. I hold his hand. Cold. Very cold. Like ice. I go desk. I write notes. When I look back. Oliver gone. Bed empty. Blanket on floor. I think he walk out. I run to waiting room. No child. I check bathroom. No child. Security check camera. Camera show Oliver walking. Slow. Down hallway. But then. Camera glitch. Static. Next frame. Empty hallway. Security say. Maybe he hide. We search whole ER. Nothing. Doctor angry. He say. Call police. Police come. They ask questions. They leave. Case close. Next night. I work again. Around 12 a.m. I hear small cough. Child cough. I turn. Oliver sit on same bed. Same clothes. Same face. I freeze. I say. Oliver. He nod. I scream. Other nurse come. She see nothing. Only empty bed. I cry. I say. He here. They calm me. They say. You tired. Next week. Same thing. Different nights. Only me see him. Always same bed. Always cold hand. One night. He talk more. He say. They send me away. I say. Who? He say. The doctors. He say. They say I okay. He say. But I was dying. I shake. I say. What happened? He say. I sleep. He say. I don't wake. I check records. Old records. Same name. Oliver Grant. 7 years ago. Winter night. Child discharged. Died outside hospital. Hypothermia. He wait for parents. No parents come. He walk outside. Snow. Cold. He collapse. Found dead morning. My hands shake. I understand. Oliver not alive. He come back. Because he never leave. He never admitted. He never saved. One night. He sit close. He say. Why they didn't help me? I cry. I say. I'm sorry. He say. I wait long. He say. I cold. I hug air. I feel cold. Lights flicker. I hear monitor beep. Flat line sound. Oliver stand. He walk to door. He stop. He look back. He say. Can I sleep now? I whisper. Yes. He smile. This time real smile. He fade. Like smoke. After that. I never see him again. But sometimes. When night very cold. When ER quiet. I see small footprints. Wet. Leading to door. And I always leave blanket. On that bed. Just in case. Emergency room is place for life. But sometimes. It become place of fear. Tonight, you heard stories of people. Who come for help. But never get help. Some disappear. Some die. Some never leave. Maybe next time you go hospital. Look around. Listen. Because some patients are still waiting. Waiting to be seen. Waiting to be saved. And maybe. Waiting for someone to remember them. If you like these true horror stories. Please like this video. And subscribe to the channel. So you never miss a new story. Thank you for listening. Stay safe.